In this video, we are going to look at blood flow. This is chapter 21, part 6. So blood flow is the volume of blood that flows through any tissue in a given amount of time period. So this is going to be in milliliters per minute. Now total blood flow, this is the cardiac output. Remember, cardiac output is the volume of blood that circulates through the systemic blood vessels every minute. Now in the last chapter, we saw that cardiac output depends on the heart rate and the stroke volume. So we got this equation here to calculate cardiac output in the last chapter. Now another way that we can calculate cardiac output is to divide the mean arterial pressure, otherwise known as MAP, by the resistance in the blood vessels. Now, as we've learned before, blood flows from regions of higher pressure to regions of lower pressure, and the greater that pressure difference we see, the greater the blood flow is going to be. Contractions of the ventricles generates blood pressure, or otherwise known as BP, and this is the hydrostatic pressure that's exerted by blood on the walls of the blood vessel. Now remember, blood pressure is determined by cardiac output, blood volume, and vascular resistance. Now, blood pressure is highest in the aorta and in large systemic arteries. And we're going to look at this diagram on the right here. So on the y-axis, we have pressure in millimeters of mercury, and then along the x-axis, we have various different blood vessels. So here we can see the aorta and the arteries. We're going to see the highest blood pressure, and that's because from the left ventricle, it goes directly into the aorta and into your systemic arteries. And so that left ventricle is going to produce a lot of pressure, and that pressure goes directly into the aorta and arteries. Therefore, they're going to have the highest pressure there. Now, in a resting young adult, your blood pressure rises to about 110 millimeters of mercury during systole. This is going to be your systolic blood pressure or ventricular contraction pressure, and it's going to drop to about 70 millimeters of mercury during diastole. So this will be your diastolic blood pressure or the blood pressure during ventricular relaxation. So systolic blood pressure is going to be this highest pressure that we can achieve in arteries during systole, and your diastolic blood pressure is going to be the lowest arterial pressure during diastole here. Now, as we get further and further away from the heart, the blood pressure is going to drop. You can see here until we get into the blood vessels or in the veins coming back into the heart. So as we get to arterioles, and then this purple section is going to be capillaries, and then this blue section is going to be the veins and venules. So here we have venules coming out of capillaries, veins, and then the vena cava that goes directly back into the heart. And so we're going to see the lowest blood pressure in those veins, venules, and then the vena cava right before going back into the heart to kind of build that pressure again. Okay, so let's talk about resistance. So vascular resistance, or just R is abbreviated in equations, this is the opposition to blood flow due to the friction between blood and blood vessel walls. So just the action of blood flowing through blood vessel walls and kind of pushing against those walls causes some friction and causes resistance. Now, vascular resistance depends on three things. So first off, we have the blood vessel lumen and the size of the lumen. Next is the viscosity, or kind of the thickness and how well the fluid is able to flow. And then lastly is the blood vessel length. Also, the higher the vascular resistance, the smaller the blood flow. So the more friction and higher resistance that we get, the less blood is able to flow. So the smaller the lumen of a blood vessel, the greater its resistance to blood flow. And then as arterioles dilate and we increase that size of the lumen, blood pressure is going to fall and resistance decreases. Now, as the arterioles constrict, you're going to have resistance increase and blood pressure rises. So that's the size of the blood vessel lumen and how it affects vascular resistance. Next, the blood viscosity. So the viscosity of blood mostly depends on the ratio of red blood cells to blood plasma in volume. So this is kind of the ratio of the formed elements of blood to the actual fluid of blood. And the higher a blood's viscosity, or the more formed elements there are in relation to the fluid, the higher the resistance is going to be. And lastly, we have total blood vessel length. Now, resistance to blood flow through a vessel is directly proportional to the length of a blood vessel. So what that means is that the longer a blood vessel is, the higher the resistance is going to be. So here we can write it out here, size of the lumen. If we have a smaller diameter lumen, this is going to be equated to higher or greater resistance, or a larger R. Put that here. So R is representing vascular resistance. Blood viscosity, if we have a higher blood viscosity, this is also going to be indicative of a greater vascular resistance. And total blood vessel length, increase in length is going to increase resistance. And then the opposite is true for all of these as well. So a larger diameter is going to have a decrease in vascular resistance, lower viscosity is going to have a lower resistance, and a shorter length is going to have a lower resistance as well. Venous return is the volume of blood flowing back to the heart through systemic veins. And this return of blood to the heart occurs due to the pressure generated by contractions in the heart's left ventricle. So that left ventricle has to be really strong and pump really well. Now the pressure difference from the venules to the right ventricle is pretty small, but normally it's sufficient to cause venous return back to the heart. If pressure increases in the right atrium or ventricle, then venous return actually decreases. It's harder to get blood back to the heart if you have increased pressure in the right side of the heart. And that's because, remember, fluid always flows from an area of higher pressure to lower pressure. And so if you have higher pressure in the blood where you want that blood to end up, it's going to be harder because then we're trying to flow from lower pressure to higher pressure, and it's kind of going uphill essentially. Now there are a couple different ways that we actually assist venous return in our body. These are by valves that we've kind of briefly talked about already. And then we have two pumps, the respiratory pump and the skeletal muscle pump. So when you stand up, the pressure pushing blood up the veins of your lower limbs is barely enough to overcome the force of gravity that's trying to push that blood back down. Now, like I said, beside the heart, we kind of have these two other mechanisms that pump blood from the lower body or from other parts of your body back to the heart. So this first one we're going to talk about is the skeletal muscle pump. And then there's also the respiratory muscle pump, or just the respiratory pump. Now, both pumps really depend on the presence of valves within veins. So here we have the skeletal muscle pump. So when you are at a standing at rest, so this first one is going to be standing at rest, you have the venous valves that's closer to the heart, the proximal valve. This one and the one further from the heart, the distal valve, are both going to be open. So this is where we have, so you can see these valves here are both open, and we're going to have blood flowing back to the heart. Now when we have contractions of the leg muscles, like when you stand on your tippy toes or take a step, this is when we're actually going to compress that vein. You can see here it's kind of compressed. And this compression of the vein actually pushes blood through the proximal valve. So we're going to increase that blood flow here. And this is an action that we call milking. Kind of like milking a cow's udder. The muscles are going to push on that vein, kind of squeezing blood back up towards the heart. Now, at the same time that this is happening, the distal valve in the uncompressed segment down here, this is going to close because some of that blood is going to get pushed down towards it. Now, just after we have muscle relaxation, the pressure falls in that previously compressed section of the vein, and this actually causes the proximal valve to close, because we're going to have blood going back down to go into this low pressure area right here where the vein was just compressed. The distal valve then down here is actually going to open, and that's because the blood pressure in the foot is higher than in the leg. So here we have low pressure in this area. So here we have a higher pressure here, and also a higher pressure in the foot. And so because of that, we're actually having blood coming up from both sides to kind of cover in that low pressure area. So this is how we're going to get some of that blood that might kind of get stuck in the foot due to gravity, and we're going to pull it up the leg just because of those pressure differences. So now that we have those pressure differences changing, we're going to fill this area with blood, and then the proximal valve is going to reopen when we have that equalization of pressures. And then we're going to kind of go through this cycle again. So we're going to open, do some milking, and then fill that vein again, and we're kind of moving blood that way. So it acts kind of like a pump to move blood from lower areas of the body back up to the heart. Now, the respiratory pump is also very similar. It's also based on this alternating compression and then decompression of the vein to cause these areas of low pressure to move blood in those areas. But the respiratory pump has to do with changing pressures between the thoracic and abdominal cavities. So that one's working a little bit closer to the heart, but it acts in a very similar way to this skeletal muscle pump. Now earlier we saw that blood flow is the volume of blood that flows through any tissue in a given time period. And remember, this is in milliliters per minute. Milliliters per minute. Now, the speed or the velocity of blood flow is inversely related to the cross-sectional area. So inversely related to cross-section. So blood flow is calculated in centimeters per second, and it's inversely related to cross-sectional area of these blood vessels. So if we put that kind of in an equation, we're going to get blood flow is proportional to 1 over the cross-sectional area. So what that means is the higher the cross-sectional area, the lower the velocity is, or the lower the blood flow is. So we actually see that in this diagram here. So in the aorta, we're going to have a pretty low cross-sectional area because it's just one blood vessel, even though it is pretty thick blood vessel, and we're going to have a velocity up here as like the highest velocity in the aorta. Now every time an artery branches, the total cross-sectional area of all of its branches is greater than the cross-sectional area of the original vessel. So that's what we're going to see as we branch further and further and eventually get to capillaries. So here the arteries were starting to branch. So you can kind of see we're starting to increase that cross-sectional area a little bit, and that's because of those branches. Because the cross-sectional area that we're talking about here is the cross-sectional area of all the branches together. So we're going to branch further into these smaller arterioles, which increases that cross-sectional area even further. And then as we get to capillaries, we know about these very extensive capillary beds. And these capillary beds are going to cause that cross-sectional area of all of those capillaries to be very high. And so because we have that really high cross-sectional area at capillaries, the velocity, since it's inversely proportional, is going to be very low. So blood flow becomes slower and slower as blood moves further away from the heart because of that cross-sectional area of all the different branches. So we're going to get the slowest velocity, which is this black line. Slowest velocity is going to be seen in capillaries. And this is actually really important functionally, because in capillaries, this is where we want to have gas exchange. And so if the blood is flowing through capillaries really quickly and we have a very high velocity, it's not going to give the blood enough time, or the blood cells enough time to exchange their materials with the interstitial space. So we really need to have a low velocity in those capillaries in order to facilitate really good exchange between the blood cells and the interstitial space. So having a high cross-sectional area in capillaries is very functionally relevant. And that's the end of chapter 21, part 6.